Duke Med-Psych program has been around for over 30 years now. It's one of the oldest med-psych programs in the country, and I think that's important when you're looking for a program to find one that's well established, has had a lot of graduates, so that there are people who have gone before you who are known around the country and here at Duke, and people who can be mentors to you as you're going ahead in your career.
I loved that there were so many med-psych faculty. I thought it was really unique that I would have so many opportunities to train with folks that had both training.
What drew me to train at Duke was just the quality of training that we get here. And I also was really excited about the fact that there are so many dual trained faculty that stay here at Duke. One, that told me that they're happy here. And two, I was just excited to get to work with so many people who are dual trained, because there are not that many places in the country and none that have as many dually trained faculty as we do here.
It's the fact that it's just a very, very clinically rigorous program to a very great extent. Residency is ultimately meant to train us to be really excellent physicians. Duke is one of the powerhouse institutions within the South in terms of education. Our medicine program has very broad experiences in pretty much everything under the sun and offers exposure to more or less every lesson you would want to learn within medicine. And I knew here that I'd be a very qualified physician within both disciplines.
I love my co-residents. We come from very different backgrounds and we're definitely experiencing the program differently, but we also have so many things in common that we're able to kind of bond over residency together, so that's been great.
We have our main hospital, Duke University Hospital, which is the standalone quaternary center. We have Duke Regional Hospital, which has both our psychiatric hospital for Duke as well as our community hospital. The Durham VA, which is a full quaternary center in and of itself, and then Central Regional Hospital, which is involved in really state psychiatric mental care.
I have loved working on our combined internal medicine and psychiatry inpatient service, just getting to see really unique pathologies and learn from dually trained faculty. The variety of integrated med-psych experiences that we have here is unique to Duke, just in terms of the number of outpatient and inpatient experiences that we can have. I think sets us up well in terms of figuring out what we want to do with our med-psych dual training, because we get to see a lot of things that you can do with it.
More recently, we've expanded and we have a lot more outpatient integrated clinics, and some of those include the VA mental health clinic, where patients with severe mental illness receive their primary care from one of our faculty. The Lincoln Healthcare for the Homeless clinic, where I practice. Residents also can do transplant psychiatry, psycho-oncology, palliative care, and some other areas where we have med-psych faculty.
Another aspect that's been a really big highlight that I wasn't really expecting was the patient diversity. But not only do we have the ethnic diversity, but we also have political diversity, we have social economic diversity, and also geographic diversity as well. And I will have a clinic day where I'm taking care of patients who are urban bankers and then going into people who are 7th generation farmers right afterwards.
Because a lot of past residents stay on as attendings, I think that does a lot to shape the culture, especially on our med-psych inpatient service. A lot of those attendings have been exactly in our shoes, doing the exact same rotations that we're experiencing. I find that the learning is so much better because it feels more like working with a colleague.
I feel like I can call any of the attendings if I have questions or if I want to learn from them. The residents are really close. We have a lot of fun together. We spend a lot of time just hanging out socially, which is really nice.
We have something called office hours. One med-psych faculty each month will take the residents out for drinks or for food. And it's a great opportunity for us all to come together in an informal setting. And it's also been an awesome opportunity to get to know the attendings a little bit better as well, informally outside the hospital.
Everyone here is always focused on intellectual curiosity, growth, and education.
So every Monday we have our Med-Psych conference. We have different speakers come who are kind of practicing at some Med-Psych overlap area and talk about different conditions. We also have residents talk about areas of interest for them, and we have other residents present clinical cases from our combined service. In addition, we have our Med-Psych faculty and resident journal club, where residents and faculty get together for an evening and have dinner and talk about an interesting topic.
Honestly, for Durham's size, it has an impressively good food scene. There are a lot of good restaurants, and so one of my favorite parts has been wandering around trying all the new restaurants here.
There's a ton of opportunities to travel as well, both to the coast and also to the depths of the Appalachian Mountains and to the Great Smoky Mountains as well.
When I'm advising students about choosing a residency program, the things you should really be thinking about are which program is going to help me to become the best doctor I can possibly be, which one is going to really support me as I grow as a doctor and a human, and which one is going to support the things that are uniquely me. And I really think that our program has all of those things to offer and more.